This next slide discusses the relationship of non-treatment, such as stopping life-sustaining treatments, and non-maleficence. As quoted by Beauchamp and Childress, religious traditions, philosophical discourse, professional codes, public policy, and law have developed many guidelines to specify the requirements of non-maleficence. The example guidelines I will discuss were previously influential, but Beauchamp and Childress found many flaws that led them to their distinct rule that I will discuss in the end. So the first example rule is when healthcare professionals are considering non-maleficence and proceeding with life-sustaining treatments, it brings forth a distinction between withholding and withdrawing. Withholding is when a treatment is not started, and withdrawing is stopping a treatment. When it comes to withholding a treatment that was never started, many families and professionals feel more justified when stopping the treatment that has already began. For example, they feel that stopping a patient's respirator is more impactful than not starting one at all. This is because caregivers begin to feel a sense of responsibility towards the patient's death when they were actually withdrawing a life-sustaining treatment. An example used in the article we will discuss in our case study to follow, it discusses how some organizations allow doctors to withhold CPR on a patient they see no beneficial outcome and rather more harm to the patient. We found this conclusion of Beauchamp and Childress interesting that they quoted the distinction between is morally dangerous. They believe the caregiver is morally blameworthy for negative outcomes if a caregiver uses this distinction in order to make a decision. The next rule is distinction between extraordinary and ordinary treatments, which was once used widely. But according to Beauchamp and Childress, it's not used as often. Extraordinary can be defined as unusual, heroic, complex, invasive, or expensive. Ordinary can be defined as usual, routine, simple, non-invasive, and inexpensive. Relating back to our case study article, CPR could be seen as an extraordinary attempt to save someone's life if the doctors feel it's more invasive and heroic than anything. The third one is another debate throughout hospital systems is to use the distinction between sustenance technologies and medical treatments in order to discuss the justification of the treatment. Sustenance technology is known as sustaining treatments, such as a nasogastric tube. So tubes, lines, and catheters that provide nutrition and hydration. Medical treatments are seen as life-sustaining, such as a ventilator or dialysis. An example of this is a guardian was able to disconnect a comatose patient from the ventilator due to the pain it was causing, but this patient was kept alive for 10 years through antibiotics and sustenance technology such as an NG tube. The patient suffered many respiratory issues, bed sores, and weight loss throughout the years. This brings up the moral issue. Since it was okay to discontinue the ventilator due to the harm it was causing and let that patient to die, then why is it not okay to discontinue the sustenance technology? With this specific scenario, the decision was to continue the treatment because these treatments, such as the NG tube, were not specifically causing harm to the patient, whereas the ventilator was. So to finish off, Beauchamp and Childress' rule that they felt was the most defensible was the basic distinction of optional versus obligatory treatment. Their main focus is based on quality of life considerations, which can be inconsistent with the previous rules. These are categorized as 1, obligatory to treat, which is wrong not to treat, 2, obligatory not to treat, which is wrong to treat, and 3, optional whether to treat. It's neither required nor prohibited. This reflects well with the previous case study we will talk about, because the healthcare team felt it was obligatory for them not to treat the patient with CPR because they felt it was wrong to treat them and will cause more harm to the patient.